Hello everyone, welcome to another presentation of our life-changing work here at London Dental Specialists. I want to reassure you that you've come to the right place if you are looking for information about how dental implants can change your life. If you like our videos, please subscribe to our YouTube channel and follow us on social media at London Dental Specialists. So let's get into today's presentation. It is about a 65-year-old gentleman who was referred to me about 6 years ago. He is retired, medically fit and well, and when we first met, I carried out gum surgery, regenerative gum surgery, on most of his lower teeth, which was extremely successful. About 9 years ago, the patient's general dentist did a load of composite bonding, which he was very satisfied with. It's lasted 9 years, but was open to improvement because the teeth were now beginning to show their age. And as you can see here, the composites look, they're obviously very worn down. They're obviously a little bit stained, but they're not that bad. He wasn't extreme. He wasn't gagging to have those changed. He was reasonably satisfied, but he said, well, he's open to having things improved if required. The reason why he came this time, though, was this upper right front tooth was fractured. The tooth with the gum recession. All right. Now let's look in a bit more detail at the X-ray of this tooth, and as you can see, instead of having a straight root, this root is a bit curved. All right, which is unusual, but does happen. And then we took this CT scan, and as you can see on the CT scan of his upper jaw, I had also placed 3 dental implants in the upper left, just to give him some more biting teeth on that side of his mouth. And if we look a bit more closely at this upper right front tooth, why was it loose? Well, you can see it there, can't you? There's a fracture line on the root of that tooth, and this explains why the tooth became loose. I always ask myself the question, why has a front tooth for no reason just suddenly fractured? It's usually because of overloading, and overloading is either due to the fact that the biting contacts are not evenly spread across the whole mouth, or there are missing teeth at the back. And lo and behold, of course, there are missing teeth at the back, because although I had replaced the teeth on the left side with dental implants, I had not replaced the teeth on the right side as well, because I wanted to try and keep things as cost effective as we could at the time. So in terms of the diagnosis, well, it's obvious, isn't it? A fractured upper right front tooth, and again, stained composite fillings, composite bonding on the upper and lower front teeth. So his options, like I've said on multiple occasions in the past, is to either just deal with the tooth in question, so replace this fractured tooth, because when a tooth is fractured that high up, literally inside the bone, as you can see, the fracture is very close to the bone. There is no way you could repair that tooth, not predictably anyway. So we can either just deal with the fractured front tooth, which is why he came in the first place, or take a more holistic approach by dealing with the immediate problem and the reason why it happened. In other words, try and even out the biting contact so that there are no areas of overloading in due course. And you can do that with either placing more crowns, more dental implants, or perhaps a combination of both. So, as you can see, the patient and I agreed that, well, yes, we could try and do crowns or maybe a few veneers on these composite bonded teeth, but because they have lost so much bone already, we decided there's no point investing more money on these teeth that have already lost so much bone, which is like building a fancy house on quicksand. Doesn't make sense, does it? So we agreed to take them all out, place some dental implants, give him some temporary teeth, and then make him some permanent teeth in due course. As you can see from this picture, that metal bar is on the dental implants that I have placed in his mouth, and my technician made me this beautiful row of teeth, which I fitted over the bar, and the patient walked in to the practice with the previous picture that you can see with his gum recession, and has walked out with his beautiful new set of plastic temporary teeth. He came in 3 months later, and as you can see, if you compare, you can see that these teeth have not aged very well. In particular, his main problems were the color and the thickness of his front teeth. But anyway, I did warn him that plastic teeth, plastic temporary teeth, do take up more stain compared with porcelain teeth. So I was pretty confident that when we made him his final set of teeth, he would be very happy. So as you can see, this is where he started with all that gum recession, and this is where he ended up. Look at those beautiful, beautiful set of teeth, beautiful set of 12 teeth on dental implants. He was really, really happy with his new smile. As you know, with every single dental implant, or every dental implant case in London Dental Specialists, comes with a 10-year warranty, and his treatment costs are on the screen right now. Why not take a leaf out of my patient's book and refer yourself if you have any loose teeth or perhaps missing teeth, or get your dentist or your hygienist or your dental therapist to refer you to see us if you have any of these kinds of problems. And I promise you, my team and I will look after you in exactly the same way as we will look after our own family, because after all, you are. Thank you very much.